Hello, welcome to this Whole Life Club Action Hour on the power of sleep. I'm registered dietitian and nutritionist Nichole Dandrea-Russert, your host for today. What if better sleep wasn't just a luxury, but a life-changing practice that evolves with us? Today, I'll be joined by Dr. Rikin Patel, a pediatrician, lifestyle medicine physician, and founder of Reset Pediatric Lifestyle Medicine to help us reconnect with sleep as a powerful tool for healing, growth, and daily resilience. Drawing on years of clinical experience and a deep understanding of human development, Dr. Patel will guide us through how sleep impacts our well-being across the lifestyle from childhood to older adulthood. Together, we'll look at how food, movement, stress, and screen time influences sleep patterns, and you'll discover realistic, compassionate strategies for improving rest across your household. Whether you're navigating bedtime with kids, adjusting to midlife sleep changes, or curious about sleep and healthy aging, this conversation will offer science-backed tools and gentle mindset shifts you can use right away. Get ready to restore your rhythm and reclaim your rest. Now, this event is a part of Whole Life Club Food Revolution Network's ongoing membership community. Some of the questions I'll be asking today came directly from our members. As always, this conversation is not medical advice. Please consult a qualified provider for personal guidance. Now, let me introduce you to the insightful Dr. Rikin Patel. Dr. Patel is a pediatrician, lifestyle medicine physician, educator, and founder of the Reset Pediatric Lifestyle Medicine Clinic, a virtual practice dedicated to helping families make sustainable, health-promoting choices. He's an assistant professor in the Department of Pediatrics at the University of Toronto and serves on the medical advisory board for the T. Colin Campbell Center for Nutrition Studies. Dr. Patel completed his pediatric residency at Memorial University of Newfoundland and holds a master's degree in health policy planning and finance from the London School of Economics and the London School of Hygiene and Tropical Medicine. Passionate about fostering resilience and well-being among medical professionals, he incorporates meditation, plant-based nutrition, medical improv, and movement into his teaching. He's also a certified yoga instructor and a long-time Shaolin Kung Fu teacher with over 35 years of experience. Welcome, Dr. Patel.
Thank you so much, Nichole, for having me. To everyone at Food Revolution Network, thank you for having me, and it's really great to be here.
Thank you. Really excited about this conversation today. And I'd love to just start with you and what initially drew you to focus on sleep as a key pillar of health, and how has that perspective evolved throughout your clinical teachings and work?
Great. Thanks for the question. So Nichole, back in 2020, I came across the American College of Lifestyle Medicine, where it wasn't just sleep, but restorative sleep was one of the 6 pillars of lifestyle medicine interventions to treat and prevent lifestyle-related diseases. But really what was so inspiring is that they're looking to empower patients, families with knowledge and life skills so that we can really try to address health concerns at the root cause. So that's where my initial exposure to to sleep as an integrated system of an approach to health was found. And so I was just, in all of my learning, getting certified in lifestyle medicine, I was just really amazed to see how, again, restorative sleep. I love how they use the term restorative sleep because it's not just sleep, it's sleep to restore. So restore to me is like to restore, to heal, to grow, right? And so how it can have such a tremendous impact on chronic disease. And so often, again, like being a physician myself, in our training, there's so much sleep deprivation. So I'm so interested in sleep just in general for my own health and well-being. But again, learning as much as I could, I got inspired now to share as much as I can on this topic. So for me, like sleep is so critical because we know that, especially, at any stage in life, but particularly for younger children, teens, sleep is tied to learning and memory formation and promoting creativity and emotional regulation. It helps good sleep helps us regulate appetite, it impacts our eating patterns, and maintaining a healthy immune system. Our heart health and our hormonal systems are all also dependent on sleep. So again, just has such it impacts so many aspects of our life. And so to me, this is really how I got interested in sleep, and my perspective and how that's evolved. I really see sleep as a habit that can not only impact all of the other lifestyle medicine pillars, but all of those pillars is bi-directional. So all of those pillars also impact our sleep. So again, for me, when I have families coming in with whatever the health challenge may be, to me, sleep is foundational. Like I see the starting point as being sleep. So if someone has fatigue issues or want to improve their diet or stress, again, sleep is such a great place to start, because if we improve our sleep, it will ripple into every other aspect of our life. So I see it as central and as a starting point to looking at the rest of our health.
Hmm. Thank you for that answer. Yes, I agree so much. As a plant-based dietitian, I used to always say, plant-based food is the foundation for health, and of course movement and, sleep and all the other things too. But now it's kind of like sleep is the foundation of health, and plant-based, like I don't know that any one is more important than the other, but
Sure.
they are so interconnected. But I think the sleep priority has definitely increased the more I've learned about it, and also aged myself and value
Mhm.
sleep. I think as I get older, I'm like, gosh, sleep is really important. And you realize just how many aspects of your life it affects. If you don't get good sleep, like you mentioned, your eating choices change during the day, your ability to focus and be creative, and just all your deep connections with those that you love can change. It just impacts so many aspects of life.
Mhm.
And I know you have a new little one. I'm wondering how you're navigating sleep with with a new baby in the house.
Yeah, well, it's definitely something we can come to later. That I see sleep as a dynamic journey, right? And so our sleep patterns are going to change based on our stage in life. And so, for example, as a new dad, I see in my infant of 2.5 months that their sleep is interrupted by hunger, right? And they're them needing to eat. As kids get older, uh, the sleep is impacted by it could be screen time, it could be anxiety. As kids age into teenage years and university, sleep is impacted by stress and long study hours. And then when you get to, my stage in life, as in a career, sleep is impacted by, let's say, shift work, right? And so again, I just wanted to show that it's a journey and it evolves and it changes and it's not static. But I really liked a mentor of mine. He always, had this really inspiring saying. He says, balance in life, it's not about always going in a straight line. It's about knowing how to come back to the center.
Mm,
And I really feel that this principle can be applied for our sleep patterns as well.
I love that. Yeah, that's great because we're always going to be swayed in either direction, but
Yeah.
coming
So
back.
are we, do we know how to come back and, at least come back to good principles and foundational, key habits?
Yeah, and thank goodness we have those to come back to. But you kind of moved into my second question with mentioning the different lifestyles. So how do sleep needs and rhythms change across different lifestyles, and what strategies can help us adapt to those shifts with just greater intention?
Yeah, no, thank you for that. So sleep has we have different stages of sleep, and to talk about the stages very simply, we have, most people will have heard of the words like non-REM and REM sleep. And I just want to explain that in a larger context. So for example, just starting off with why these sleep stages are important. So for example, in non-REM sleep, which is the majority of sleep that occurs in adults, that's the phase where we have, for example, that's the first half of the night where we have deeper sleep. And in that deeper sleep, our short-term memories convert into long-term memories. It's where our body heals. So for example, that's where the restoration occurs. So we are building up our immune system, restoring our bones, muscles, and tissues, versus the REM sleep, which tends to happen in the second half of night. It's a lighter sleep. There's more sensation and perceptions. For example, that's where we dream. And that's important for memory consolidation. It's also important for brain development, emotional consolidation. So the reason I'm mentioning this is because now if we look at life as from the time span is that when we're infants, particularly 50% is non-REM and 50% is REM sleep. So the reason why there's so much more REM sleep is because we have that strong like push to develop our brains, right? Especially in that first 5 years of life. There's the neural synapses, the synaptic activity, the density of our brain is forming, and this is why we spend more of our time in REM sleep. But as soon as we get to about the age of 5, then that ratio shifts a bit. So then it pretty much goes to 70% being non-REM and now 30% being REM sleep. So that REM sleep decreases. And then furthermore, when we get to adulthood or when we get to teenagers into, most of adulthood, it then goes from like an 80-20 split. So 80% is non-REM and 20% is our REM sleep. So we see that the amount of non-REM sleep as we get older increases, and that REM sleep, in time also then decreases. So that's how the stages of sleep change. Now, in terms of some strategies on how to approach it, again, for toddlers and children, I always come back to what I like to call as simple but not easy, but having a consistent bedtime routine. So first of all, having a bedtime routine, I think is really important in the younger years. It's shown that the most positive impact we can have on our sleep quality, and duration is choosing a consistent bedtime. And we know that consistent bedtimes, it leads to longer sleep duration. It leads to decreased sleep latency. So we fall asleep faster and we have reduced nighttime awakening. So that's, when we're younger. As we get older, like for example, in adolescence, many families don't realize is that at adolescence, because of puberty, that actually causes a shift in our circadian rhythm. So the hormonal changes will also push our sleep pattern. So normally when we used to sleep, let's say at 10 o'clock, the shift that occurs naturally pushes our circadian rhythm, where we sleep maybe 1-2 hours later. And so honestly, the best way that we can strategies to approach at this stage in life, and this is really a mandate that's coming through the American Academy of Pediatrics, is that they're promoting schools actually starting at a later time to accommodate for teenagers having this shift in their circadian rhythm that happens naturally, but to accommodate to start later. And what this has shown actually in the research is that we have teenagers who are better rested, we have less tardiness, and we have better academic performance. So that's something that I recommend at adolescence. And adolescence is also a time that I'm also open to, as a strategy, using the nap very tactfully. Because I do think a nap has a restorative effect depending on the amount of time. That's a whole, another topic, is the science of napping. But I think the nap is really important at adolescent phase. And then when we get older, what it can be really helpful is bright light therapy upon arising, having consistent meal times, regular moderate to vigorous physical activities. These are all strategies that can help us later in life to improve our sleep as we go through these, as we mentioned, natural changes in our sleep cycle.
I feel like that was really so well explained. Thank you. And I feel like a lot of teenagers are going to be clapping in the background because you are, you got science to say that they need to sleep later and they should take a nap, right? The nap will
Yeah, I
help.
mean, I'm here to share the science, but also to, give, also inform parents, because a lot of parents don't know. And I think there's a lot of pressure and sometimes shame put around needing, sometimes sleeping late, sleeping in, not being able to get up. And so I really want to try to alleviate the stress and the pressure for our younger generation.
I think that's so important. Yeah, and I'm sure a lot of parents are going to appreciate hearing you say this and describe the science behind it. And yeah, I think we have certain expectations, right? As parents, we think that they should, and the way that the system is set up, the way the school system is set up. So
Yeah.
to hear that it may change is great. That's wonderful for families. Okay, so when families are experiencing chronic sleep challenges, maybe in the case of the teenage person who has to get up early and gets exhausted by the end of the week, or any other cases, where do you typically begin? How are there any foundational habits or insights? You did mention some, like the consistent times. Is there anything else you'd like to add around foundational habits or insights that tend to unlock some meaningful change?
Yeah. No, thanks for this. So I think first of all, when we look at chronic sleep challenges, as a physician, I'm always tasked with looking to see if there's any organic or medical cause for the sleep challenge. So, for example, just while the most common challenges with sleep are generally like insomnia, I'm still looking at other causes for sleep challenges. For example, up to 4% of the pediatric population have obstructive sleep apnea, right? And so that is something that is reversible through, you would potentially, that's usually due to enlarged tonsils and adenoids. So that would require a surgery. For example, there's like parasomnias, for example, sleepwalking, sleep talking, restless leg syndrome. So I'm just naming off a few of the medical related sleep issues that come out that I'm always screening for. So I think it's first of all important in my approach to first address and rule out any potential medical causes. And so we have ways to assess sleep, to screen for sleep patterns, and so to use our tools to help determine that. But if we're dealing with insomnia, and if I feel that it's lifestyle related, then as an approach, I show parents what I look when I look at sleep hygiene. I look at it from 4 different perspectives. And so the first perspective of sleep hygiene is our preparation. So, for example, as I mentioned, the sleep routine, and we know that having a bedtime routine, as we mentioned, increases sleep duration. You fall asleep faster. You don't wake up as much at night. The second component of sleep hygiene I see is the actual timing. So when we go to bed, right? Because that also, to me, it's if we need to wake up at a certain time, it's never about. It's always about when we go to sleep rather than waking up. Because if we're going to sleep at a decent time, usually the body naturally will want to wake up at a certain time. So the timing. The third component is the environment, the sleep environment. So, for example, that means in our rooms, for example, do we have extra light coming in? Is it as dark as possible? Are there any TVs or screens in the room? What is our screen time used prior to bed? So this all encompasses the sleep environment. And then finally, the fourth component being our sleep habits. So I wanted to kind of just zoom out and see that we could use these 4 components to really look at sleep hygiene from a more kind of holistic way rather than always just looking at like one specific way to cure all sleep problems. It's a combination of all of these. And so again, when we're looking at chronic sleep challenges, particularly insomnia, which is the most common, affects up to 30% of children, and even more adults, that we look at it from this perspective. So again, some strategies that I mentioned, in addition to, is at least 60, ideally 90 minutes before bed, not having a screen, because we do know that has a huge impact on our melatonin secretion and our ability to create that sleep pressure to fall asleep. Again, that conducive sleep environment, but then really also parents and their modeling. So in our clinic, because we're focusing on kids, I always tell parents that also, although you've come here for your child, Johnny or Sally, we want you to see this as an opportunity for the whole family, right? And so generally, when our parents are modeling the behaviors, we know that in so many different lifestyle behaviors, there's a greater uptake when kids are seeing the example. So again, if we're trying to ask our children about their screen times to reduce it, as parents, also looking at our own screen times and seeing how we can model that better. Mm-hmm. And so these are just some of the things that I want to bring up when we're looking at chronic sleep challenges.
Yeah, thank you for that. In your experience, you mentioned screen exposure, and what about nutrition, physical activity, stress? What kind of effect do they have on sleep quality?
Okay, so you've opened up a big question. Yeah, there's, you mentioned nutrition and you mentioned physical activity and stress and these different areas. So maybe I'll just, if you wanted to, we could just go through it like one at a time.
Sure.
And first of all, talk about nutrition. So you alluded to this at the we were briefly touched upon at the beginning. But one important thing that I want everyone to realize about is their nutrition is that it's not just, I mean, again, there's the relationship goes bi-directionally. So sleep impacts our nutrition, and our nutrition also impacts sleep. But at least when we're looking at nutrition, let's look at food, for example, what we eat, right? So there's foods that are conducive and not conducive. For example, foods. We always talked about like foods high in tryptophan or melatonin, right? So these are generally foods. So when we're looking at different foods, berries, nuts and seeds, soya, so tofu, tempeh. These are all really great foods to help increase levels of tryptophan, melatonin. But then when we're looking at foods that may not be as conducive, for example, when we're thinking about, for example, caffeine, right? So many people don't realize, but caffeine has a half-life of 4 to 6 hours. So that if, ideally, if we're really wanting caffeine not to have any impact on our body, we should be looking at what time. The latest we should be having it is probably by 1 p.m. because if we're having it later than that, just the way it breaks down in our body, it will definitely have an impact on our sleep. The other type of substance that's consumed that also impacts sleep, that although some people see it as a sedative, alcohol also has a tremendous impact on our sleep because again, it's processed in the liver and has it is well established to cause sleep disturbance. So again, when we're looking at foods for and against, but then the second aspect of nutrition is when we're eating, right? So the times of day. So we all know that we've had that really late meal, that we've stayed out late, we've had that either the late night munchies or had that late meal, and we immediately know that like we haven't had a night where we've slept well. So again, as a just a rule of thumb for everyone, but really like phasing out, like depending on when you go to sleep, in the ideal world, we're having at least a window of 3 to 4 hours of no food prior to bed. But as a general rule of thumb, if we can at least keep nutrition and all the food we eat to prior to 8 p.m., I think that's a great strategy to look at how to improve the quality of our sleep. Yeah. And then on the flip side, our sleep also impacting our nutrition. So I know we've talked about this, it goes both ways, but we do know that sleep duration has an impact on the food choices we make. So a lot of families in my clinic come who want to improve their eating habits. As we know that weight concerns, obesity is a growing epidemic in the younger generation. So a place that I start is always by focusing on sleep, because I say, hey, when we're sleeping, when we get enough sleep and our quality of sleep is better, what that means is that our hunger and satiety hormones, so ghrelin and leptin, they're in better balance. So we actually make better food choices. We can say yes to the good things and no to the not so great things. We can make better food choices. We also know that there's less tendency to snack on higher ultra processed foods when we're sleeping better. So again, just wanting to talk about kind of that the direction goes in both ways, food impacting sleep, and then sleep also impacting our food choices. So that's just from a nutrition perspective. Did you want to add something? Because as a dietitian, I'm sure you have something to add on nutrition.
Yeah, I mean, I definitely summed it up. I feel like we can have a conversation about this for the whole hour.
Oh, this one's a whole episode.
You summed it up beautifully. So thank you for that.
Yeah. If we're moving on to screen time, right? So when we talked about screen time, we know, so one thing to recognize about screen time, at least how it's related, I'll just quickly touch upon how it's related to nutrition, is when we're in front of a screen, we actually tend to eat, researchers showed, up to 60% more of what we're eating than we normally would. Is because what happens is when we're in front of the screen, our satiety cues get all out of whack, right? And so basically we just, we've all been a subject to like just continuously, this behavior when we're in front of the screen, and it's, science is there to support that. So again, we know that when adolescents who are meeting the screen time recommendations, which is still a very small proportion of our adolescents, we know that there's 55% lower odds of reporting poor sleep. So in fact, that the more we're consistent with regulating our screen time, the more positive impact it's going to have on our sleep. And again, as I go back to mentioning before, it's that blue light. As soon as it hits our retina, which is our eyes, it basically tells there's an area of our brain called a suprachiasmatic nucleus to stop producing melatonin, right? And that melatonin is what creates the sleep pressure for us to fall asleep. So again, that's why there's always this emphasis on reducing blue light exposure, prior to sleep. And, again, like there are people that are using like blue light filtering glasses. I've tried them out myself. It's hit and miss, but I welcome everyone to try it. But again, just this this association with high screen time causing sleep deprivation and poor sleep quality. So that's what I wanted to mention in regards to screen time. Physical activity also a huge topic and how it impacts sleep. So we know that people who are getting moderate to vigorous physical activity, we know that it's promoting better sleep. So just improve sleep duration, because we know that physical activity increases melatonin secretion. And so that's great. Not only does it increase melatonin secretion, but because generally when we're active, the core body temperature increases, and that follow up to that increased body temperature is a lowering of our body temperature. So that cooling effect on our body actually helps promote sleep, because we all know that we actually need a fairly cool environment to fall asleep, right? So again, that the temperature regulation that we get from physical activity also is conducive to sleep. We know that moderate physical activity increases our total sleep time, the sleep quality. We're less stressed, improved mood, and there's also a neurotransmitter called orexin, and we know that we have lower levels of orexin. And orexin basically promotes wakefulness. So we have lower levels of this wakefulness neurotransmitter in our body circulating when we're doing physical activity. So that's a little bit on sleep. One fascinating thing that again, when I was getting ready for thinking about this discussion, I touched upon, and I haven't read it in full detail, but there was a Brazilian study that showed in adolescents that physical activity can be a mitigator. It can moderate the effect of screen time's impact on our quality of sleep, right? So really interestingly, they found that those that were getting a more moderate to vigorous physical activity, their sleep wasn't, even though they had a certain amount of screen time, their sleep, wasn't as impacted. So again, showing that moderating effect. The way I tried to do it is that, try to frame it is that if you have a lot of screen time, there's also an invitation for more physical activity.
Right. Yeah. And the power of physical
Yeah,
activity.
so powerful, because we know that not enough not enough physical activity, lower energy, more fatigue, less motivation for activity, less desire for movement, more tendency for sedentary behavior, less physical endurance. So many impacts of when we are when we are not sleeping well, how it impacts our desire for physical activity.
Yeah. And again, back to the whole like everything is interconnected topic, sleep can help alleviate, I mean, sorry, yeah, well, sleep can help alleviate stress, but what I meant to say was physical activity can help alleviate stress, which can help you sleep better. And, the physical, is interesting to hear you talk about like the physiological effects of the physical activity and the neurotransmitter that may impact sleep. So, there's so many things happening directly and indirectly. Yeah, so better nutrition, moderate screen time, less screen time, at least not before bed. And that's a hard one for folks, I know, but we all
And
want to
more
start.
physical activity.
Yeah, and physical activity. Yeah,
Yeah.
wonderful. I'm really interested in um, this. Actually, before I move on to that question, let me ask you this question.
Mm-hmm.
How do you, we're talking like, we're generalizing a little bit here. You actually went really greatly into the different stages, which was very helpful to see. But in your experience, how do you help patients and learners move beyond like a one size fits all
Mm-hmm.
mindset approach? And like, kind of include like a lifelong practice, especially when dealing with families, because everybody's different, right?
Yeah, no, this is a really great question, because what I feel this question also brings out is that again, as I mentioned, this looking at sleep as a journey, looking at it from different life circumstances, and trying to get behind get into people's lives and ask them, different aspects of their lives that determine their level of sleep. So, for example, we now know that sleep is becoming looked at from the perspective of like equity. So, for example, we know now that culture, socioeconomic status, ethnicity, these all have an impact on sleep quality, sleep duration. And there was a study that was done just to touch upon this. They looked at like 9 different countries, about 30,000 different kids, and it looked at sleep duration amongst the different countries, and it found that Asian countries, the kids in Asian countries between 0 and 3 years old had about 2 hours less sleep a night. And so again, this is really just to highlight the point. And again, this is why this often comes up, where it's not a one size fit all, but really incorporating and taking these factors into consideration. So as we mentioned, like, what are people's backgrounds? And a lot of families, because I'm sure we know all families, even including my own family, there was a tendency sometimes to eat late, sleep late, and that happens a lot of times in discussions with my families. But I tell families, hey, we're empowered with so much more knowledge on sleep, its benefits, its impacts when we're not getting enough, that, hey, although this may have happened to us from our families, let's turn a new leaf and let's make different choices for our own children. And so, but as you know, like, when we're talking about lifestyle medicine, behavior change for children, again, speaking to that one size fits all, it's not always as simple as it is for you and I as adults, because we're always looking at our children, our teens, through the lens of the parent. So, for example, with children, there's so many other factors to consider: the age, the maturity, and the cognitive development, the temperament of the child, the environment that they're in, their peer company, the level of parenting skills that the parents have. That is in there's a huge spectrum of parenting skills that I see that make it both supportive and sometimes challenging for us to actually make recommendations. So again, all of these factors need to be considered, so that we're looking at it more from an individual basis rather than a kind of a blanket. Okay, I mean, again, I always say we have general principles, but the details of how they apply, that will differ from family to family based on the situation.
Right, that makes sense. Thank you for that. Okay, so this question, I'm really interested in this, and I want to make sure I'm pronouncing it right. You've integrated, is it
Shaolin, yeah.
Shaolin Kung Fu, yoga and meditation into your work for decades. So, at first, I don't know. I think folks probably know yoga and meditation. I'm not sure how common Shaolin is. I'm very curious about it, so I'd love to hear more about that. And what role do these traditions play in shaping your own approach to rest and recovery?
Yeah, thank you. I appreciate the question on just integrating some of my own practices and how that's impacted my lifestyle. In our clinic, because of my own these practices that you just mentioned, in our clinic we have a yoga therapist that can meet with families. We have a qigong and a tai chi expert. He's actually my teacher. He's a Shaolin monk. I've had the good fortune of training with a Shaolin monk from China, and then we also have a sleep coach. But just starting with myself, like, I started kung fu when I was 7 years old, and what I wanted to share is how that's impacted, for example, my sleep. Is, as most families will realize, like, I was that young kid, boisterous, had tons of energy, rambunctious, mischievous, but it really provided me an environment to really channel that excess energy in a very controlled way.
Hmm.
So, for example, just having physical activity as a regular mainstay in my childhood growing up, again, it was a great stress buster. Sometimes I even found that even though I did physical activity late at night, I could, at least for myself, it was so helpful for me to, like, have a good sweat, a shower, and then I could fall asleep much easier. The quality of sleep was great. So But one thing I wanted to mention about martial arts specifically is that there's a system built in to help regulate emotions. So we always, and I feel like emotional regulation for our younger generations is really more and more important because stress, anxiety are like growing in our younger generation. But because in martial arts there's a system of you have a built-in system of meditation, of breath control, of repetition, of doing things, movements slowly. I think all of these factors also, I would you say, in my own experience, have contributed to like better sleep for me.
Mm.
So just to kind of share that kind of unique perspective that I feel that, again, it's not to say that other activities can, but I really feel like it's built into the culture of martial arts that is inherently, going to be helpful to regulate our emotions. And there's a lot of research also to share that share that specifically different types of martial arts, but martial arts in general is really good at promoting self discipline and emotional regulation. So that's
Mm.
kung fu, how it's helped me. We also I've also recently over the last 5-6 years been more interested and have studied qigong. So there's a lot of good research on qigong. Qigong is for people that may not know, it's like the breathing aspect of martial arts. So
Mm.
it really focuses on channeling our breath, our energy. But again, we have I found for myself it's improved my sleep, and there's good research to show how it improves sleep quality, um, able to sleep faster, less insomnia. So again, just as an overall way of life, I feel that there's practices in here that can improve our sleep for those that may have not tried it and are curious. And then again, you mentioned yoga and meditation. So again, we could have a whole discussion on yoga and meditation and how that impacts sleep. But I would say for myself, I see it. Like you could look at yoga and meditation kind of in from three different angles. There's the asana or the poses, and we specifically have different yoga asanas or poses that in fact promote sleep. So for example, when we do poses with our legs up, when we do inversion poses, the camel, the bridge, and these are all poses that actually will help the headstands. These are all poses that help are conducive to promoting sleep, right? We have when we think about meditation and breathing, that's the breathing aspect of yoga is pranayam. So that's the breathing aspect. And so that's where we're focusing on different types of breathing. But in yoga, they actually divide the body into two hemispheres, so the left and the right side. But when we're wanting to activate our rest and relax nervous system, the parasympathetic nervous system, we're actually going to breathe through our left nostril or lie on our right side to open up our left side to breathe in. So this, in fact, also conducive to relaxation and promoting sleep. And then finally, there's a whole branch of yoga called Yoga Nidra, which is focused on physical, mental, emotional relaxation to help promote sleep. So again, a huge topic that I'd love to go into more, but I would say both my own personal meditation practice and when I do have time for asana, my meditation practice is daily, without fail, regardless of what's happening in my life. But I really feel that this has contributed greatly to my sense of well-being, mindfulness, and my sleep.
Yeah. Thank you for all of that. We'll have you back to talk when we have our yoga and meditation month. I mean, you can talk about it alone, but 'cause you're so knowledgeable and passionate about it. And yeah, I love a good yoga nidra session. When I cannot fall asleep, I'm like, gosh, put that on and I'm out. And or even just like you mentioned, the different postures. Sometimes I'll do a restorative, if I've had a very busy day, you can feel the adrenaline going just to
Yeah,
kind of like activate that parasympathetic, like chill out, rest, and relax. A couple of relaxing yoga poses and some deep breathing is, it doesn't have to be anything extensive. 5 minutes
yeah.
of and it just is enough to like reset and it feels so
Yeah, I
good.
mean, I'm sure we've all been to a yoga class in Shavasana at the end. We've heard someone falling asleep, right?
Yeah.
Uh, and even Yin Yoga. Yin Yoga is like that whole branch of yoga that's just dedicated to holding a pose for a long time, right? Like 5 minutes, 10 minutes, 15 minutes. And it's hard for the mind, but it's really great as a restorative practice.
That's one of my favorites too. Yeah, yin is great. Yeah, so hopefully folks have got some, you can do some family yoga to help you all to like rest and relax and engage your breathing and a little bit of meditation before bed, and you all sleep really soundly. Okay, so what trends or shifts are giving you hope about how families and communities are rethinking the relationship with sleep?
Wow, that's a great question. I love this question because it really is like a possibility mindset type of reflection. And I was thinking about this, about what was inspiring me prior to this. And I was just thinking that, first of all, just there's a greater recognition now, and more research is going towards sleep and like as a health equity issue. And so looking at sleep from different angles, such as culture and background and socioeconomic status, and bringing that more into the forefront, this awareness that there are trends that showing that um, for example, lower socioeconomic status individuals will have is tied to either poor sleep patterns, less sleep, sleep challenges. So just that recognition of it being like sleep and health equity, bringing that out more through research, I think is a really great thing that's happening. And I think that awareness and that knowledge will really allow everybody to make better sleep choices, and also just for us to be more understanding and compassionate individuals, because sleep is so vital to every aspect of our life.
Mhm.
The second thing that I was thinking about is there's a huge like upswing in research now on time in nature and forest bathing and how that impacts sleep. So I'm really inspired by how nature is impacting sleep. So, for example, time in nature improving improving our focus, reducing our cortisol levels, reducing, having an opportunity to improve like us being able to fall asleep faster, so less sleep onset latency. um, it's just like, these are just a few things, lowering blood pressure. So again, there's so many great research findings that are coming out on forest bathing, time in nature. Again, not only is it improving our immunity, but just using, again, what I always tell parents, these things that I'm about to tell you sometimes are simple but not always easy, right? Because there's so much more time now in all of us spending time inside, right? Because of this pull towards more time for screens. So again, just going back to first principles and basics. So I think that is really inspiring, how I'm trying to educate and talk to families about how to improve their sleep, is just going back to something as simple as more time outside, feet on the ground. Um,
Mhm.
I think there's also a plethora of more research now coming out on yoga, meditation, and how its impact on sleep, particularly in the pediatric population. So that's also something that's really inspiring me, is pulling out the research, the growing amount of research, good research, just randomized control trials, uh, how improving our sleep is having an impact on mental health conditions like anxiety and depression, and how we can use our like different tools in our toolbox, but specifically mindfulness and meditation as a tangible tool to help us with reducing anxiety, with improving symptoms of depression. Now, first line for ADHD. So again, these are all like big topics that are happening in the younger generation that I'm really inspired to see how we're having more and more research come out for this younger generation on mindfulness and meditation and its positive impact on sleep.
Yeah.
And again, just how the field of lifestyle medicine is really pushing out the knowledge and the research on restorative sleep, so that we can learn more about how to learn more about sleep. Sleep is, again, a very evolving field, especially in adults. It's been around for longer, but in kids, maybe around for the last less than 50 years. So there's still a lot to learn, more to know, but again, more research, more education, more knowledge coming up about sleep. And I love how lifestyle medicine as a field is pushing this forward. So yeah, these are a few of the the things that are really giving me energy and inspiration in my practice.
Love that. Well, I think that it's telling when you mentioned earlier that the Academy was shifting their recommendations on sleep for teenagers, that
Yeah.
recognition is there based on research. Like it shows that there's more research being done, and we're listening and accommodating and changes, because sometimes it has to start from like a authoritative or a systems approach, or like you said too, where kids are everything's online now, right? Like
Mhm.
they're always on their computers, everything's online. So I think that also, the system is built in such a way that they may be spending less time in nature, but that, like, I feel like drives the importance of nature even more, like taking those intentional breaks to get out in nature to restore and recalibrate so that they do sleep well, and then just for
Yeah.
overall better health.
Yeah, for sure. Just one more thing to share. There's, because sleep deprivation and not getting enough hours sleep is a growing challenge in both adults, but particularly our younger generation. And there was a really interesting study. It came out, I think, about 2 years ago. It was in the Lancet. So it was a big study, and they looked at adolescents, and they've started now taking MRI, so pictures of the brain. And what they did is they showed that kids who've had 2 hour sleep deprivation for a period of 2 years, their areas of gray matter actually were reduced volume. So I kind of interpret it as like your brain is a little bit shrunk. And these are the areas that are tied to uh, memory, learning, impulse control, emotional regulation. So really important areas that are being impacted. Now they're actually capturing pictures of these changes on MRI when there's extended periods of sleep deprivation in our adolescent population. So I think, again, I always say knowledge is power. So with this education, being more aware, we can make better choices.
Yeah, the awareness is the first step, right? And
Hmm.
then being able to implement a lot of the tips that you're offering today. I wanted to share one quick story
Yeah,
about
please.
nature. The other day, I had a long day. There was a friend in town, and had, work, and was just juggling a lot of different things until like right before bedtime, and I could feel my body was in a very energetic state. And this was not intentional, but I had to take out my dog for her, last going to the bathroom of the night, and I always walk her out. So I just like walked her out, and it was so quiet outside. And we're in this like summer to autumn phase where like
Mhm.
things are shifting in nature. The trees are getting feel like they're getting a little bit more quiet, and it was just a really quiet night. And I took her out, and it's usually quick, and I bring her right back in, and then head to bed. And I handed her off to my husband. I was like, "You take her up." I'm like, I need just my body. It was like that nature called to me in this way. My body and mind just needed to stay in that space for like 5 minutes, and I did nothing. I just sat outside, and it was exactly. I felt like in my mind, I'm like, this feels like a nature bath. You mentioned forest bathing, and I didn't, use the term forest bathing. I'm like, it just feels like a nature. Like it just felt like it bathed. The moon was full. Like it was just such a setting that completely restored. So it wasn't daytime, it was just like a peaceful evening that really made a difference in my sleep, and I
Mhm.
know it made a difference. So sometimes just listening to those cues from nature sometimes can like really help you shift your energy. But yeah,
Yeah.
yeah,
Yeah,
it's
no, thanks
powerful.
for sharing that. That's a really great story, and it also speaks to just kind of the concept of our circadian rhythm, and how there's different times of the day. If we look at just the day as a circle, and there's different times in the day where different hormones are being released, and if we can fall more in line with nature's design, uh, it's a simple just observation that if we can just fall more in line with nature's design, that we can
Mhm.
easily improve our sleep by just syncing up a little bit better.
Yeah, thank you.
And I think your story really, like exemplifies that.
And yeah, it wasn't intentional. It was just like, walked out. Clearly, I needed it because I walked out there. I'm like, oh, I just need to stay here for a moment. And then it like clicked. I'm like, oh, yeah, I need to calm down.
Yeah.
And nature is like helping me do that. So, yeah, that makes sense what you said. I'd love to move on to a few member questions if you have a little time to answer the
Sure,
question.
sure. Yeah. Let's see.
Okay. So, Judy S. asked if there are any supplements that you would recommend for sleep. Presently, she takes a CBD gummy at night.
Okay, so when it comes for supplements, at least the ones that I have more experience with, So depending on, I regularly recommend just melatonin. I know it's not seen as a supplement, but it is definitely something that helps reduce onset of sleep. So, for example, it'll help you fall asleep faster. I think melatonin is very safely used. One other supplement that I've also personally tried and have found that it is helpful is magnesium.
Mm.
I think magnesium is a great supplement, and there's different ways you can take it. You can take it in a powder and drink it. Some people actually just take it topically, put it on their skin. So again, just magnesium, I think, is a great supplement to promote sleep. I don't know so much about CBD with sleep, but I do know that it's being used. But for me, like magnesium's a go-to for sure.
Yeah, I agree. I see in my practice a lot of middle-aged women who are experiencing perimenopause or menopausal symptoms, and I feel like they could be doing all of the right things. And sometimes a little bit of magnesium in the evening before bed, it really helps them get into it, just helps them relax to get into a better sleep pattern. And yeah, I agree with you. I think magnesium can be beneficial. Some of the supplements are really high though. Be careful. Like there are supplements out there. I always, whenever I see, if somebody asks me about magnesium, I always look to see the amount because you can get too much of anything.
Mhm.
So it's so important to look for like third party testing and then the amount of the supplement, especially for those who are eating either plant forward diet or a lot of plants. You're getting, so magnesium is primarily found in plants. You're probably getting a lot of
For
magnesium. So
sure.
just be sure we're not like getting too much in your supplements. So there's a little fine line there. And it's always good to ask, your qualified healthcare practitioner about supplements if you're
Yeah,
unsure.
definitely. And I think someone like yourself, I think, is really helpful. I regularly refer to my dietitian and talk to them about specifically like dosing,
Yeah.
um, because I feel that you and your practice specifically get into more of the specifics around frequency and dosing for our supplements.
Yeah. Thank you. Yeah. Yeah. And you mentioned melatonin. I was going to ask about kids. I know this question is coming from an adult, but
Yeah.
you mentioned melatonin as a supplement. What about the research in children?
Oh yeah, no, it's great. So there's plenty of research for melatonin in children, and it's we know that it's safe. Long term use, there's no challenges, and again, depending on especially with kids who stress, anxiety, kids with autism, we do know that when that sleep onset can be very long, that melatonin can help reduce that. It won't. I always tell parents it'll help you fall asleep, but it doesn't necessarily help you stay asleep.
Mm, got it. Thank you. Cheryl S. asks, at 64, I've started weightlifting, changed my diet to 95% plant based, and am now exercising 5 days a week. Awesome, Cheryl. My concern is I'm so tired. I'm now napping 1 to 2 hours most days and 8 to 9 hours of sleep at night. How concerned should I be about all of the sleep?
All right. So Cheryl, thank you for this question. First of all, I want to commend you on all the great lifestyle habits that you've taken on. Uh, in personally, again, without knowing too much about your background, I would say that like getting 8 to 9 hours of sleep, no problem with the stage that you're at. And I also feel at your stage in life, I also feel like having that nap during the daytime is also it's very supportive. I see no problems in taking that nap as long as it's not interrupting with your sleep at nighttime. Again, the recommended guidelines typically at your stage in life would still be around 7 to 9 hours of sleep. So again, you're within that. And I don't see the sleep during the day again, unless there's other symptoms going on. But if it was just the requirement for extra sleep, despite this great lifestyle, uh, obviously check in with your doctor to see if anything else is there, but just on this, the based on the sleep guidelines and your physical your activity patterns and your lifestyle, I would see it as being okay, nothing to be overly concerned about.
Thank you for that. And I wonder too if there's like an adaptation period depending on how, like if you do all of those changes at once, weight training and exercising and plan, you made a lot of changes, especially weight training. I feel like that's
Yeah, there's a recovery period that's required, right? And
yeah.
so I see, again, that I come back to the term restorative sleep, right? Where we're storing, we're healing, we're growing. So I see it as also positive with the lifestyle that you have.
Yeah, great. Alexandra asks, I always struggle with sleep. Takes me an hour to fall asleep and get up once or twice during the night. I do meditation, breathing exercises, roll on with essential oils, she's doing all the things. Not using the laptop an hour before sleep, and nothing is working. Darn. Are there any more suggestions to help me get some proper sleep? Please and thank you.
I would say that, again, specifically because we're dealing with, you said the sleep onset. The first place I would go to is melatonin, and if that hasn't been tried, to give that a try. Uh, for adults, a dose of 10 milligrams, there's no concerns with taking that. But I would say just try something as simple as that to see how that goes. Honestly, for most people, adults that have tried it, they usually have a positive effect. So, I mean, I think the other lifestyle habits that you have are all great. I would insert this and see. There's, in terms of just, I think we touched upon it before, depending on what your breathing practices are. We discussed a little bit about asana, about yoga nidra, about having specific types of pranayama practices that could also help conducive. But again, in addition to those, trying some melatonin.
That's a great suggestion. Thank you. Yeah. And also, I love your suggestions of like maybe trying some like what you mentioned breathing, but maybe some other like the yoga nidra or something to take your mind off of it. Because I've also seen sometimes, and I've done this myself. When you're doing all the things and you're still not sleeping, you're like, why am I doing all the things? I'm not. You're kind of like stressing out about the not sleeping thing. And, even though you're doing all the things, it can become a stressful
Mhm.
cycle that you are doing all the things and then you're not sleeping and you kind of worry about it. And I've been
Yeah,
there and I know people, but I think those practices like yoga nidra that can really take you out of your mind, really,
yeah,
like in another space and not thinking about it.
yeah. Again, and just coming back to how we were talking about sleep hygiene, looking at the different quadrants or components that we talked about. I think the environment's important to look at. You know, our life circumstances, stressors. These are all there. Again, there's so many interplays and areas that are interconnected that I think all require to be looked at in addition to just the practices we may have right before sleep.
Thank you, Dr. Patel. This has been so inspiring and so educational. I've learned so much, and I'm sure all of our members have as well, and will appreciate all of your advice. I'm sure we're going to be hearing a lot of great sleep stories after this, and we'll share them with you.
Thank
So,
you.
thank you.
Yeah, no, it was really great. Thanks, Nichole, again for having me and the Food Revolution Network. Really appreciate the opportunity to be here. And again, Nichole, hope we can still stay connected.
Yes, absolutely. Thank you. We got to get into that yoga and meditation conversation next. Yeah.
Yeah, no, again, I would be happy to. Again, most of the providers that we mentioned on our team, they're open to. Although I'm here in Toronto, again, our clinic is virtual, so if people are interested in a yoga therapist or learning more about qigong, tai chi, more about their sleep, we have all our providers are available virtually, so anywhere
Oh,
in the world.
well, that's wonderful to know. Thank you.
Yeah.
And is there, where can they go online to find you and find
Yeah,
this?
so I'm not sure if we can provide, like I can provide like it's Reset Pediatrics
Uh-huh.
will be the website. We
Yeah,
also have this an Instagram and that you can follow us on, and I have a YouTube channel that I'm talking about lifestyle medicine, but specifically for our providers, they would go to Reset Pediatrics.
got it. Okay, that's a great resource. Thank you so much again, Dr. Patel.
Great, thanks so much, Nichole.
When it comes to cancer, Alzheimer's, diabetes, heart disease, and other chronic illness, what really matters isn't how many books you read how many webinars you attend or how much you know. What really matters at the end of the day is what you eat and how you live. The science has given us what we need to know. Now it's time for action. It's time to implement and optimize your healthy lifestyle. It's time to get results. It's time to say goodbye to confusion and hello to clarity. It's time to say goodbye to bad habits and hello to good ones. It's time to fall in love with foods that love you back. It's time to join a community that will support you in achieving your goals. It's time for Whole Life Club.